Greetings once again. It's a pleasure to be back, and apologies for not being able to share this on Sunday as usual. So today I'm going to talk about continuous medical education for healthcare professionals, and these are CMEs. And the key thing for me is to look at why there's a need for improvement and what next for us in actually improving the aspect on continuous medical education, making them deliver value for us. And therefore, for us to be able to do that, we'll have to look at it in the sense of why do we have the continuous medical education programs? That is the continuous professional development. Then what kind of CMEs do we have at the current moment? Who is offering these kind of programs? How are they being offered? Then where is the gap? So that because when you're talking about improvement, we are moving from one particular level to the next level. And when you review some of the concepts that I earlier shared, when you're talking about project management, the key thing about project management is looking at we're starting from a baseline, getting to another level. And on that account, then we need to have a clear monitoring and evaluation mechanism that gives us actually an evidence of where we are moving to where we need to with the desired outcome at the end of the day. And this particular session is inspired by a discussion I had actually on Saturday with a colleague and a senior professional within the practice who has been keen on driving access to diabetes care to patients all over the country. And in some of the key things that we are discussing, we looked at well, that some of the continuous medical education programs that we're launching out and rolling out to healthcare professionals might not be giving us the ultimate results, or they might be effective, but there are gaps that are existing in the whole framework on continuous medical education, and therefore we are not able to see the results or the expected impact of the contribution that we're driving, and therefore there's a need for us to improve. And based on that discussion, I'm going to share some of the insight that we shared and some of the reflection that I had on the same. And how can we then, as healthcare professionals and with a bias towards pharmacists, drive this change in continuous medical education? And one of the key things that we have to acknowledge, especially in the pharmaceutical industry, pharmaceutical sector, is that pharmacy practice is evolving. And as pharmacy practice is evolving, we are moving from the product-oriented to patient-centered care. And other than that, even our practice is changing to a competency-based practice, where we are looking at what skills do you have as a pharmacist, what competencies do you have, and then how do you leverage on these competencies and the social context on where you're existing to be able to deliver those solutions that are key and are needed by the patient that you're serving at your community pharmacy or your hospital pharmacy practice in the industry where you practice as a regulatory affairs specialist or a pharmacovigilance specialist, or even in any other supply chain related role or a pharmaceutical space that you are, even as a marketer. So then the question that we need to ask ourselves at the start is, why do we have continuous medical education? From the basic tenets of continuous medical education in the sense that education is actually designed to equip you with skills, knowledge, and information that is enabling you to make the right decision in the medical practice. That is why it's medical education. We're training in the medical components. And it is continuous, realizing that the practice of medicine keeps evolving over time. And therefore, as practice evolves, then you need to be able to acquire new knowledge, new insights, and new understanding of the techniques, skills, and the knowledge about the workings of different products that you're going to use, let's say, for example, from a pharmacy perspective, the medicines that we're using. So why do we need CMEs? To be able to be equipped with the current and most relevant and scientific evidence of the therapeutics and even the treatment plans that are available. 2, to keep appraised of the trends and even to gain new knowledge and new insights that are critical in terms of us serving the patients. 3, as a refresher, and refresher means there are certain concepts that we did study in our undergraduate programs, master's programs, and even in our postdoctoral programs. And with all these trainings, there are some of the components that we normally forget. So the key aspect of the CMEs as well would be able to remind us of these concepts and help us awaken that realization and that knowledge in us to be able to serve the patients well. And that is the ultimate why of CMEs then. We'd continue educating you to remind you, to enlighten you about new advances, and to appraise you of the practice trends across the world and every other place in the medical space, with a focus on equipping you with the skills, competencies, and know-how to be able to serve your patients the best way possible. And in serving your patients the best way possible, it's not about giving them multiple medicines, about performing every single surgery that you need to perform, but being able to respond to the needs of that patient, whether it's a surgical procedure, whether it's a medication error that is there you need to correct, whether you just need to review their medicines and give them a lesser number, that is medicines reconciliation, whichever it is that you need to do, need to be for the best interest of the patient. Are they healthy? Are they enjoying having the best kind quality of life they would perceive it to be? And are you helping them in achieving that by taking an active role in that journey? If you are able to achieve that and patients are at the best level of health as they deem it to be, then you are achieving the positive outcome that we need. And if a CME, a continuous medical education program, is able to equip you with the knowledge, insights, and the know-how to be able to help that patient to that extent, then it is effective. And that is why we are looking at, why do we need CMEs? So what kind of CMEs do we need or do we have at the current moment? So currently when we look at CMEs, we need CMEs that are able to equip you to deliver on the why of CMEs, as I've mentioned. And the kind of them that we normally have, we have the lecture theater kind of CMEs or the webinar models where we have lectures being delivered, somebody sharing insights and knowledge about a particular practice trend, use of particular set of products and all that. And that is the one form of CMEs that we normally have. Other kinds of continuous medical education would be in terms of fellowships and tutorships, or even apprenticeship programs, where as an professional in practice, you'd go to a particular institution, practice under someone who is a senior or a specialist in that domain area. And as you're doing that as part of your education, you are learning, you're practicing, and you're gaining the skills that are relevant and essential for you to be able to gain the skill. And when at the end of the day, now you have the autonomy to deliver your services, you're able to do it better. And that is another model of CMEs as we talk about. Another model will be in terms of case reviews and case studies. And these are where you have case patient scenarios and even incidences in terms of practice, which you as an individual in your field of practice will review, establish the best practices, identify the shortfalls and the gaps, and find mechanisms of addressing them. So those are the kind of CMEs that we normally have. We have lectures, we have case reviews and studies, we have tutorial fellowships, even internships. So all these kind of CMEs do exist. So who offers most of these? You'll find some of the ones that I've mentioned in terms of lecture programs. They will be driven by professional associations in terms of their commitment to advancing practice in their domains, which is a responsibility of professional associations. So that is one of their roles. Other than that, you'll find some of them will be offered by pharmaceutical companies and medical device companies, which are key on, part of it is promotional because they're creating knowledge about the product that they've manufactured, that they need to be used. And for them to be used, then they have to go through healthcare professionals. So the best avenue is to enlighten the healthcare professional about the use, the functionality, and even the key features of this product that makes it key for use in certain patient populations. So that is how why they would sponsor such kind of activities. So the biopharmaceutical companies have a role to play. We have the professional associations, and then we have educational programs, that is learning institutions, which also have an interest in terms of promoting learning. And it is within their core domains that they promote learning and get other people, practitioners, to come on board and learn with them and practice with them in these particular institutions. That's why over time we have tutorials, we have fellowships being called on, postdoctoral researchers, research fellows, research associates. So every other component of training that would enable someone to do better in their line of practice. So we have talked to training institutions. Other aspect of it will have the ministries, the government institutions, or even the healthcare institutions that we are working for. A healthcare institution or even a company that has employed you realizes that there's a particular service they would be keen on offering, but they don't have this required skill set to deliver it. And therefore, they would recommend you going for continuous medical education, whether it's training that they're financing or not, depending on the modalities of engagement, there is a component to it in that particular area. So then once we know that those are the kind of programs that we have, the people who offer or support such CMEs, then the next thing for us would be, how are CMEs offered currently? As much as I've talked about the different models and the different people who offer them, majority and actually the bulk of continuous medical education programs are driven by the biopharmaceutical industry, and they anchored on some of the professional associations one way or the other as promotional avenues to reach out to as many people as possible. It's not wrong to have these biopharmaceutical companies promoting such programs, but the design and the model that is used has to be responsive to the needs of the patients and the healthcare practitioners, with the commitment and the vocation to deliver quality care to the patients. And therefore, the model that they're being offered is, most of them are delivered in terms of lectures. They're sharing probably most of the time same knowledge or same information that has been read over time, which also gets to the point of reminders, which is a role of CMEs. But we can't be doing reminders on a day-to-day basis on every other cycle. And then the other key bit would be, how do we transfer that learning? So most of it has been in that sense of lectures, series of presentations and all that. And then after that, you move to the next CMEs, you move to the next CMEs. And ultimately, we don't have clear assessment mechanisms. And these are the kind of gaps that we are noticing that we need to close these gaps and ensure the CMEs are actually achieving the mission and they are ultimately delivering better outcomes for the patient that we are serving. And some of the gaps that we're looking at is in terms of how do we assess the value of the CME? If I'm supposed to be enlightening you, then most of the times I realize that we should be having baseline surveys to establish the level of knowledge and understanding of the professional about the particular concept that we're learning in that CME program that is there. After that, at the end of the day, we have the end, after the baseline, we have the end term evaluation, the end closeout evaluation, where we assess whether the training has improved on their understanding, has improved on their skill levels, if it was a practical skill. Other than that, we might not be able to measure whether our CME is achieving value or not achieving value. And if you're not able to measure, then we've lost track of what we need to do. So that is one of the key things that are currently missing in most of the CME program that we're having, and that needs to be integrated. Two, we have skills and competency development. When you're training a healthcare practitioner, healthcare professional, you can't be talking about different jargons, different components and concepts that are important in their practice. But as much as you do that, they don't regurgitate the same kind of knowledge and information back to patients. They need to be able to contextualize it to the particular patient case scenario. And therefore, in that case, then we need to have skills and skills transfer mechanisms. That is where we talk about apprenticeship, tutorship, fellowship programs, where as a junior professional or as senior professional or even peers within the industry, you can collaborate based on your level of expertise in the particular concepts and gain the skill in actually doing it. There's no way you would expect me to perform a surgical procedure without having learned from someone performing it. And therefore, could we have more of such in the continuous medical education programs where we are supportive in terms of engaging people better, learning from them, and making them realize that we can learn by sharing these skills and building their skills in individuals. In a pharmacy perspective, I'm looking at it in the sense that you have a specialist clinical pharmacist that performs medication therapy monitoring, medicines reconciliation, and related programs. If as a junior or as a not so advanced clinical pharmacist in that space, you'd be willing to learn, the best place would be to share notes and work with them in the remodeling and review of patient treatment plans. And as you do that, you're gaining understanding of key medicines, the rationale of the interactions, and even monitoring the progress of particular patients that such services have been offered to. And in so doing, you gain the skills and you're able to now apply the same in your own personal practice, which is a critical component. Then the other bit is hands-on assessment of impact. How do we measure the impact of our work? If I've been training you as a clinical pharmacist and we look at the role of a clinical pharmacist to be patient-centric care, where we're looking at improved in terms of quality of care, reduce pill burden for patients, where we can do medicines reconciliation, all that kind of contribution, are we able to monitor it, that impact of that training? If you're talking about diabetes care, we've trained you about how to manage diabetes, flagging from the types, diagnosis, management, or tampering doses, to look at the best option that is available for the patient. After all that training, do we see that kind of knowledge that has been shared through the CMEs in your day-to-day practice? If it doesn't exist, then there's a gap already because we're not assessing the impact. And then if you're getting to the point of applying it, then we should be able to see the positive outcomes in the quality of patients, outcomes that we see, the reporting mechanisms, if at all you've not been reporting, especially when you talk about pharmaceutical supply chain management. So we need to measure the impact. I've trained you on management of diabetes, I've trained you on management of asthma. You've managed how many patients in a particular period. The number might not change because some of these chronic conditions would be the same for the same population over a period of time unless you're getting new add-on patients. But over the number of patients that you're managing, is there an improvement in the quality of life, which is one of the reasons for our CMEs? The core reason is to improve the quality of living and the health status of the patients. So is there an improvement? And that improvement, is it driven by your intervention? What are the monitorings? So those are the kind of things that are there. Then ultimately, the culture gap. Do we embrace continuous medical education and learning as an aspirational aspect of our continuous professional development and as a way for us to be the better professional that we seek to be? Or is it a mandatory requirement for us to renew our licenses and continue practicing? One of the key things that we've noticed is that we have not inculcated a culture of continuous learning in ourselves as professionals, and as such, are therefore missing out on certain aspects that would be critical for the future of our profession and for our own advancement. And that is something that we need to look into. How do we inculcate that culture? And that culture is driven by a sense and commitment to continuous improvement. And with a sense and commitment to continuous improvement, then we build on it as we get to the next level. We build on it by wanting to know more about a particular concept, wanting to try to apply these new skills that we've gained. And once we've applied it, we are looking at monitoring and actually developing best practices. And those best practices will inform the next generation. And therefore, it becomes a way of living that we're looking at me as today as a David, as a professional in practice. I want to be better tomorrow. For me to be better tomorrow, I need to learn today, apply the skill tomorrow. The day after tomorrow, I'll document the best practices for my intervention. Then once I document the practice, I now use it to share that knowledge with other people. And that will give us the room for continuous improvement and advancing the future practice. So what next for us? The first thing is to acknowledge that we have a shortfall in our continuous medical education programs and embrace continuous improvement and champion for the same in our practice. Once we've acknowledged that, let's look at how to assess the value of continuous medical education. And it's not assessing the value for the standard CMEs. It's assessing the value based on what kind of patients am I dealing with. If I'm in, let's say in Western region, Kenya, where there's a high burden of malaria, for example, and the most important thing about it is we are in the month of April where we'll be celebrating World Malaria Day on 25th of April. As we commemorate World Malaria Day, the key thing that I would be asking myself as a pharmacist, if I'm based in the Western region, is how am I improving access to care for patients with malaria? And if I look at that perspective, then the key is one, how do we actually deliver prevention programs? So can I build capabilities for pharmacists and healthcare professionals to be able to contribute to community engagement and mobilization on vector control? Then once that has been done, and even use of mosquito nets, the distribution, that is the preventive phase. Other than that, do we model diagnostic mechanisms around professionals in the space so that it's actually purpose-driven capacity building? It's not purpose-driven. It's not just education for the sake of education, but it's education driven by the needs of the patients we're supposed to serve. Then once we finalize on that phase, then now move to the next phase. What key skills do they need to get? Look at the diagnosis, the curative and complicated referral mechanisms. How do we refer patients? Do we have a mechanism of doing it? Is it effective or not effective? Who are the probable stakeholders or ancillary services that we need to add on to those particular services? So that we look at delivering value based on what is the need in the community, what value proposition do we have, and how do we plug it into existing frameworks and systems to ensure that we have continuous and sustainable integrated healthcare delivery models and systems in our ecosystem. Once we do that, now we deliver these programs and assess the value prior to after and see how that is impacting their quality of practice as individuals. But beyond quality of practice, if I've introduced some new skills in myself and I'm able to serve better, it should not only be ending at the point of me serving patients, it should be measured in terms of the quality of outcomes and impact on the patient delivery. So the question would be, do we have less incidences of malaria, let's say in that region, if that is the focus area? Do we have less incidences of children dying of complicated malaria because they're being treated before it's complicated? Or do we have less cases of let's say, uncomplicated malaria that is not getting treatment because we have a robust referral mechanism that will ensure they get into the hospital early, they're treated early enough, and therefore they recover. So what are the mechanisms? So we need to measure that impact. Ultimately, are we documenting these impact values that we're seeing? Because if you're going to talk about the value of continuous medical education, value of professional practice, all of it has to be documented for us to have a metric that we're using to measure where we are, where we were, and where we are heading to, so that we have an aspirational target, and that aspirational target is based on where we have been, where we are, and what we wish for, and therefore we drive that movement together. And these are some of the key things that we looked at, and I feel when we rethink our continuous medical education programs and reimagine the future practice for the betterment of the quality of care for the patients, we'll be at a better level. And on that note, as I'm ending this particular video today, I'm inviting you as African Pharmaceutical Network. We'll be hosting a series of webinars towards the end of this month with a focus on how community pharmacies can help us drive optimal malaria care. And that is one of the key things that we'll be looking at. It's a continuous medical education program, yes, but it's targeted towards ensuring the particular population of community pharmacies can serve their patients better and then help us eradicate malaria by 2030 as we wish for. But at the same time, position us as integral players to reduce the malaria burden as per the Kenya National Strategy 2019 to 2023, hoping to halve the number by 2023 from the metrics that were measured in 2016. And I'm hoping we'll be able to achieve that. If you find this educative and informative for you, please subscribe to the channel, engage with us, share your comments, share with your colleagues as well. Let's learn and promote our practice together. Thank you so much, and I look forward to on the next video on Saturday. Thank you.